Hello, everyone. Today to be reacting to a global health media project. This is a channel name. We're going to be reacting to two videos actually. The story of coronavirus and Ebola. This should be interesting. Without further ado, let's begin. A production of global health media in collaboration with Yoni Goodman with content reviewed by CDC, IFRC and UNICEF expert. Okay, that's pretty good. Part 1, how it spreads and how to protect ourselves and others.
The new coronavirus, too small to see, spread quickly from person to person,
True.
town to town, and country to country, to all corners of the world.
It started from Wuhan, right?
Any one of us can catch it, spread it, and get sick. When a person infected with coronavirus
breathes, talks, coughs or sneezes.
Jeez. But I don't think people cope into the pace of another man. This is kind of weird.
Tiny droplets with millions of harmful viruses
Oh no.
spread into the air and land on everything
Poor potatoes.
nearby.
without realizing. The viruses enter our body. We breathe them in. They land in our mouth,
Jeez.
nose, and eyes.
That's kind of disgusting.
And we pick them up on our hands, then touch our eyes, nose, or mouth. In these ways, the viruses enter our
Viruses are everywhere in our body now.
body and infect us. Most people don't get very sick with coronavirus. We can have this virus and not know it, and easily pass it to others
And it is dangerous.
who pass it to more people. In a few weeks, a whole neighborhood can get infected.
Damn.
Most people who get sick get better on their own, but some, especially the elderly, and people who already have illnesses, can get very sick and even
True.
die.
That's unfortunate.
Coronavirus spreads when people are close together. To protect ourselves and each other, we need to stay away from crowded and enclosed places and keep our distance. Wear a mask to protect others and ourselves.
Yes. We should all wear masks to avoid close contact with each other.
Keep our hands away from our face. Cover our cough or sneeze using our bent elbow. Wash our hands often and well with soap and water. And clean surfaces that are touched often with disinfectant to make them safe.
Okay.
All these
There's some preventive measures for you.
actions can help stop the spread of coronavirus and keep ourselves, our family, and our communities safe. You can follow these actions and stay safe too.
Part 2. Right, another day. We've just reacted to the story of coronavirus. Now we're going to be reacting to the story of Ebola. Right, let's jump into it. Alright. Global Health Media Production. The story of Ebola.
This is the story of how
I love the animation style of this.
my village survived Ebola. Bats brought the tiny Ebola germs. Too small to see. So small, yet
Damn, they're eating bats.
so dangerous. Without realizing, grandfather rubbed a little blood in his eye.
Jeez.
Ebola germs came into his body.
That's scary. I would touch your face again after that.
Days went by. Then grandfather got a terrible fever and weakness.
Oh,
We thought
boy.
it was malaria, but he was soon much worse. He had vomiting and diarrhea. His fever got even higher. I ran to get the nurse, but grandfather had already died.
What?
I was
That was like so quick.
heartbroken. The nurse thought it might be Ebola, a disease caught from bush meat, but which spreads from person to person. Others in our region had already died of this new disease. Unless we understood the disease and followed their rules, it could spread further and kill many more people. She explained that Ebola was in the body fluids of someone who was sick or had died of Ebola. Their sweat, tears,
Okay.
mucus, saliva, vomit, diarrhea,
That's a lot of symptoms.
urine, breast milk, sexual fluids, and blood. When we touch a sick person's body fluids, the Ebola germs can get into small
That's actually really scary.
breaks in our skin or into our eyes, nose, or mouth. The Ebola germs spread into our body and make us sick. When somebody dies of Ebola, that body is much more contagious.
Jeez.
No one should ever touch the dead body.
Okay.
The nurse advised us to wash our hands with soap and water right away. She contacted the trained burial team to help us bury grandfather's body safely. The burial team came. They comforted
It's nice that someone understands Ebola virus. Is it a virus or a disease? I think it's a virus. Otherwise, the whole village should be infected by now.
us and explained what they had to do to protect us. The team wore protective clothing that kept them safe from the dangerous germs. They sprayed grandfather's room and his body with chlorine to destroy the Ebola germs. They put his body safely away in a bag. To prevent the spread of Ebola, no one could touch the body of anyone who had died with signs of the disease.
Damn.
They also burned his mattress, bedding, and clothes. Anything that might have his germs. All these actions made
That's tough for the family.
safer. It was too great a risk to follow all our traditions. But we still honored grandfather in the time of Ebola. Our chief gathered all the villagers together after grandfather's death. He explained that it's natural for us to fear Ebola, but if we trust in our health workers and follow their rules, we could stop the disease.
True.
The nurse explained to us, when a person has symptoms such as fever, don't touch them. Get them to the treatment center right away. They will have the best chance of surviving and they won't spread Ebola. She advised us to wash our hands with soap and water many times a day. The whole village agreed to follow these rules. Since we all had close contact with grandfather, we were at risk of getting Ebola. We had to stay home. A health worker visited us every day to see whether we had fever or signs of sickness.
Okay, that's very nice.
We would show signs within 21 days if we had Ebola. Many days passed, and I thought we would all stay healthy. But one morning, I found my mother burning with fever. I knew
no.
I couldn't touch her. She was now contagious. My father came in.
Will the medical workers able to save her?
He told me he was taking my mother away to our uncle's house in the nearby village. He was afraid to take her to the treatment center, afraid he'd never see her again. I knew I had to stop them. I was young, but I stood up to both of them. I told them, this could be Ebola. She must go to the treatment center right away. We needed to trust in our health workers to save her, save ourselves, and save our village. I saw in their faces that they understood. Running away would only lead to more death and suffering.
That's actually good.
My mother tested positive for Ebola. They found her a bed. At first, the health workers looked scary, but I knew they wore the suits to protect themselves.
Okay.
And inside, they were normal people like the nurse. They took good
Everyone wears masks, but that doesn't mean they are bad people.
care of my mother. They gave her fluids, medicine, and food, and helped her body stay strong to fight Ebola. I missed my mother very much, but I could still talk to her on the phone. Sadly, some people in my village didn't survive, but my mother got better day by day.
Damn.
Soon, we were able to see her from a safe distance. One day, the nurse announced that my mother would live. Now we were safe to hug and kiss her. It was a day to celebrate.
That's very
Our
awesome.
village followed their rules. We trusted our health workers, brought us sick for care right away, called for the safe burial team when one of our people died, and we always wash our hands with soap and water.
Yeah, that's nice.
Our village survived Ebola. Yours can too.
Damn. Okay, that's the end, I guess. Yeah, that was actually a good story. And they teach us about the Ebola too. That's pretty nice. That two videos was actually really informative. I really enjoyed it. We need more people to watch this type of videos to learn something about the virus or disease. It's actually amazing that they make animation like that. It's very good. Also, let me know down in the comments what other songs or videos would you like me to react to next. Literally any song or video you want, request me in the comment section below. I'll react to it within few days or in the same day maybe. If you want to check out all my recommended equipment used in the video, check out the affiliate links below, which can get a small commission but no extra cost to you. Also, don't hesitate to comment what you thought about this video. Okay, I'm gonna end the video there. Make sure you subscribe to this channel, get more subscriber. Hit that bell notification so you won't miss any uploads and you get notified every time I upload a video. Like the video to help out YouTube to recommend this video to many people around the world and share this video with your friends, family and relatives. And I will see you in the next video. Bye bye.